Today on Keynotes, author and registered nurse Paulette Snowby discusses her book, April's Revolution, a modern perspective of American medical care of Civil War soldiers and African slaves, which explores the medical advances developed during the war, from professionalized nursing, modern anesthetizing techniques, and other medical advances.
So many folks have had wrong opinions about the medical care during the war. And I thought, well, surely something good came out of the war. And that's where this particular portion of this book will be on the medical advancements. And I'm going to go over just a few of them, but kind of ease into some information that I hope you will learn something new and different. So the medical advances are revolutionary because they're going to change ideas and the way you think about something. It's going to be a completely different idea or a function or an organization. So today we're going to be looking at these changes, and I hope by the end that some of the mythology will be dispelled and you'll come across with some really good ideas and you'll pass that information on. One of the biggest changes was by this gentleman, Dr. Jonathan Letterman, and he was from the North. Young man. He did the most significant far-reaching innovation that there was. He developed a totally different system. Now, if any of you have been exposed to an emergency situation, whether you were with the military or an emergency room, you were actually being treated with part of his system. And you will see as we talk how some of this has evolved. But it turned out to be three major focuses. Standardization of not only supplies, but how you did everything and your equipment that was brought to you. Everything was standard. Everybody got the same thing. The medical chain of command, rather than the quartermaster being in control of what happened, and a separate ambulance corps. Now, has anyone ever heard how at the beginning of the war, and this is true for the Revolutionary War as well, that every regiment had their own ambulance and it usually belonged to the general and he rode in that ambulance? We've all heard that, right? Well, that stopped after the Jonathan Letterman system came into play. And what happened is his system provided for a rapid and efficient evacuation of the wounded from the field, the battlefield. This alone saved many lives. The other thing that he worked on was triaging. Yes, there was triaging being done. Does anyone remember what triage is? You've watched MASH? Okay, you know. Okay, so your casualties are put into priority of treatment. Well, they did this and it was like, okay, we're training the doctors how to do this. And actually, towards the middle of the war, some of the nurses actually began to do some of it as well. So triage was a very important thing, and of course today in military medicine, it continues as such. Now, the main thing that Letterman's system did is it shortened the amount of time that the person who's injured receives medical care by a professional physician, all right? And how this resulted is, people did not bleed to death on the battlefields anymore if they used the system properly. Now, this Civil War Rucker ambulance, this was one that they finally decided to use by the Union. They went through all kinds of different trials and errors. In the past, the Quartermaster Corps was in charge of the ambulance service, and they would put soldiers in it, supplies, a general could commandeer it. When they put the ambulance service underneath the medical director of the Army, then that all stopped. It was only for the wounded. The other thing that happened is, let's say your buddy got shot, 6 of his buddies came along and picked him up and took him off the field. So there's less men fighting, and they probably didn't even know how to carry him or what to do with him. So all the ambulance attendants were trained on how to properly evacuate and pick up the injured person, and none of these other soldiers had to leave the field of battle as well. So those were some of the major changes. When did this really start? Well, he fooled around with this for a while, and then he first tried it out at Antietam, or Sharpsburg, from the South. And they noticed that there were some weaknesses, so he changed a little bit of the system and re-educated a few people. And when they finally were all working really well, then July 1863 happened in Pennsylvania. Gettysburg. So that was the true test of the Letterman system, and it was perfection. You will read memoirs where soldiers were saying about how they were administered by physicians, the ambulance would pick them up, and so forth. And everyone was pretty much in sync, and it worked so well that was carried on. But I have to throw a clinch into this thing. Not every single army followed this in the North. There were some who didn't. So every Union army did not follow the Letterman system, unfortunately. Now let's talk a little bit about the South. This guy is my hero. I am a real organizer, and this gentleman was too. Dr. Samuel Hollingsworth Stout. Dr. Stout was the medical director of the Army of Tennessee, and he was not only administrative, but an organizational genius. During the Battle of Chickamauga and Chattanooga, started all the Atlanta campaign, all the way down throughout Georgia, east and west, and into Alabama. He hopscotched staff, the Field 10 hospitals, the wounded. It was just like clockwork. Those people never were without supplies. He knew what was happening, what battle, where the Federals were coming from, and this man just orchestrated this to perfection. Been several books written about him, but the interesting thing to note is this gentleman kept every single record and every single requisition throughout the 4 years that he was in service. At the end of the war, he was destitute with his family. They had nothing. Ended up in Atlanta, and he actually became a general practitioner right here in Roswell for 10 years. I found in some of his papers at Emory that there's some thank you notes from some of the Pratt girls, thanking him for his service, and a few other residents of Roswell. Now, when he died, his children had to have something, and his wife had to have some way of having a living back then, and he had tried while he was still living to have the federal government buy his memoirs, his papers, all these papers, and they refused to give him a dime. So he wouldn't sell, he wouldn't give them away. So his family subsisted on the fact that they went to 4 different universities and sold those papers, and that's why we have this information today. Being a nurse, okay guys, we have to talk a little bit about nursing. And of course, the birth of nursing was because of Florence Nightingale, and she was a real sanitary-driven person. She got her training at Kaiserwerth in Germany, and then was asked to go down and form a nursing team down in the Black Sea, where the Crimean War was going on. And through her efforts of organizing and cleaning up the place, she saved thousands and thousands of lives. When she came back to Great Britain, she instituted a lot of her ideas to the different hospitals and developing a school of nursing there as well. Now, the women in the South and the women in the North, as well as the doctors, knew about Florence Nightingale. In fact, she actually came over during the war and visited here. So there was a lot of things that they adopted because of her ideas. And the idea of the Pavilion Hospital and the air ventilation, that was brought over with Florence. At the beginning of the war, nursing was really in its infancy. The only trained nurses were the sisters, the nursing nuns. And both sides utilized the nursing nuns throughout the war. The first being from Emmitsburg, Maryland. They came down into Frederick area. So the women who helped out as nurses, they were thinking, we really need some training too. But they were under the doctors, and they kind of, had to watch, and each doctor kind of took care of his own nurses and trained them accordingly. So what happened is, as time went by, the men who were nursing were actually invalid soldiers recovering, and they thought it was too hard on women to be nurses. Can you imagine? You give birth to children, but it's too hard to be a nurse. But because of so many casualties and the demand, then women started to be appreciated and coming into the sector. So We'll talk a little bit about the Federal Civil War nurses. When this happened, the whole social order of the 19th century changed. Women were allowed to be outside of their family and caring for strange men. They also had to give up some of the men had to give up some of their traditional roles because the women became managers of the plantation. They worked outside their homes, perhaps in the postal service. Some of them went into the arsenals and were making the cartridges. And we've heard about all those kinds of things. They had tiny little hands. They were very good at that. So the women finally have left the old home section. And what we have here are some people who are outstanding women. The first you probably have recognized is Clara Barton. Clara Barton worked in the Postal Service, the Patent Office in Washington, D.C. And she heard about what was going on in the Battle of Antietam, and she loaded up a wagon with food and medical supplies and took herself to the Battle of Antietam. And while it was raging all along, she was feeding them and taking care of the wounded. Now, there is a marker there, a memorial right there on the battlefield where she was shot at, and the soldier standing beside her was killed. So she was definitely on the battlefield. The sisters, they were sent to the battlefields as well. So they were not just back in general hospitals being safe. And of course, the nurses were not just the dietitians. Some of you have read how they cooked and did the prescription diets, but they also did letter writing. They changed wounds, dressings. When a lot of these soldiers came in, they hadn't changed their outfits for 3 or 4 weeks. So they would, of course, strip them down and scrub them up and clean the wounds and dress them. I mean, besides, there were only a handful of male nurses to do this. So the women were engaged as well doing this. One other interesting note about Clara Barton after the war, we're going to go ahead here a little bit, is she went down to Andersonville Cemetery and she helped to identify the Union dead at the cemetery and to have their graves marked. She also, after the war, had a missing soldiers office, which National Museum of Civil War Medicine has adopted and has renovated, and it's in Washington, D.C., the exact office. Let's talk about the Confederate nurses. Most of the Southern women who nursed had no training, obviously. But you know what they did? They were taking care of their families. They were taking care of the slaves. They were taking care of the neighbors all these many, many years. So it was very easy for them to step into the role to be a nurse. I'm going to tell you about a few of them that you may never have heard about. The first one is from Tennessee, Ella Palmer. She rushed to Shiloh while the battle was going on, and she worked day and night, and it's been documented that she actually got to administer chloroform and bind up the wounds of the wounded. Another gal who you may not have heard about is Juliet Ann Opie, and she established a Confederate hospital in Richmond. Now, Richmond had a lot of the states had designated hospitals, like Alabama paid to support a couple of Alabama hospitals, and she was the matron of those hospitals. And in the South, they called the nursing director the matron. Well, she was out rescuing the wounded during this Battle of Seven Pines, and she was wounded, and it left her with a permanent limp. Kate Cumming, who I have a picture here, was a Scotch-born, lived in Alabama, loved the South, and she rushed off to Chickamauga, and she became part of the Atlanta campaign, nursing the entire way to the end of the war. She was kind of an interesting gal. She wrote a diary, which is wonderful. If any of you get a chance to read her diary, it tells you names of a lot of the doctors of Tennessee, Army of Tennessee doctors, as well as some of the nurses, the male nurses. So it's really interesting, and it gives you the flow of the tent hospitals and the staff throughout Atlanta and Georgia. Phoebe Pember, she's probably one of the best-known matrons because she was one of the matrons of Chimborazo in Richmond. And after Richmond fell, she stayed during the Union occupation and cared for both the Union and the Confederate wounded. And the last one I want to tell you about, which you might have heard of, is Sally Tompkins. Sally was given someone's house, it was called Robertson, Mr. Robertson, and she made it into a hospital, a private hospital in Richmond. She was such an avid person, advocate for sanitation and lovingly caring for the wounded, that she got a lot of notoriety. But the thing that was so interesting about her is she had the lowest mortality and morbidity rate of any of the hospitals in Richmond. At that time, suddenly, the Confederate Congress decided no private hospital should be allowed to be opened. But people went to President Jefferson Davis and said, please, 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 let her keep this hospital. And he made her a captain. So Captain Tompkins kept the hospital open throughout the war. Well, the value of nursing continued to grow, and here's a few pictures of some of the different graduating classes throughout history. But it wasn't until the Spanish-American War that led to a permanent Army Nurse Corps. And today, modern nursing and trauma nursing is very special. It's a lot of clinical decision-making, and you notice female and male alike. Okay, so we're going to change a little bit. Another innovation, and I'm going to get a drink of water here, is surgery and treatments. Thanks to Fulton County Teaching Museum, they lent me some of their equipment, and I got to take a few pictures. A lot of this is the amputation equipment. So at the beginning of the war, there were only a few military doctors who had a lot of experience. Very few had, physicians period, had experience with surgery. So they had to either be thrown out or they had to learn, okay? One doctor by the name of Jonathan Letterman, sound familiar? He requested a board of experienced doctors to oversee the operations that were going on in the general hospitals, so that every patient who came through who needed a surgery had to be examined by this board, and they would say, yes, this procedure is to be done, and this particular doctor will do it. And this was the birth of medical necessity and consultative medicine. Sound familiar? When you have to have a procedure, don't you have to have a certificate of medical necessity? Well, it all began way back with Jonathan Letterman again. So surgeries were improved and various innovations came about, and I'll tell you about some new approaches were in orthopedics, plastic reconstruction, chest and abdominal surgeries, neurological eye surgeries. The reason why they didn't do a lot of abdominal surgery, they were afraid of infection and pain control. But with anesthesia, they could now do it. But of course, that infection risk was still high. This gentleman on the left, any of you recognize him? This is Dr. Hunter McGuire. He came from Winchester, Virginia. He was the medical director of the Stonewall Brigade. He was the gentleman who amputated Stonewall Jackson's arm. Now, he's noted for that, but after the war, he really became big-time news in Virginia. Opened up colleges, he wrote all kind of documents, trained lots of doctors, was a president of AMA for some time. He just really blossomed into this fantastic physician. Another innovation that came about, it didn't work well in the Crimean War, nobody could do it, but the first time it was done, the doctors in the North and the South both did it, and that's called arterial ligation, and that's where you sew shut an artery. In the past, what did they do? They just clamped it off and burn it, okay? But you can't connect burnt arteries together. They also worked on connecting nerves together too. So the doctors became very proficient with this. Neurosurgery also grew at a very alarming rate because of all the head injuries. You're standing with a rifle, guess where you're going to get hit most of the time? Standing up. Not behind a tree, in the head, right? So that many times they had to do burr holes to let the blood out or the swelling of the brain. And this is the type of equipment that they used over there. Now we know that worked even since the times of the Egyptians. So this was not new, but it was something that had come back into vogue. And even today, we still do burr holes. And our maggots. You know, maggots are the worms that come from flies. So all this wounded folks are all out among the pasture land and everything, and their wounds are all covered with maggots when they come in. Well, there was a doctor from the South, Dr. Joseph Jones, from outside Savannah, from Montevideo Plantation. And he looked at those wounds and he saw the maggots, and they pull them off, especially the gangrened wounds. And by golly, those maggots were eating diseased tissue. Those wounds were healing faster. Patients were surviving. So they started using maggot therapy. Unfortunately, after the war, that kind of, went away. But today, it's coming back in vogue again, just like leeches. Leeches are back in vogue again. Medicine and tools. I sent around my stethoscope. None of you have seen it. We'll pass that around again for those of you, and you can try it on each other. This is just a replica. That's sort of like what the stethoscope looks like beside my Littman stethoscope. Both the federal and Confederate medical departments recognize that when you're wounded, you're in a state of shock for some period of time, okay? And very eager doctors who did an amputation or would do surgery on you immediately or within 2 or 3 hours, these patients were dying left and right. There was another Confederate doctor, Dr. Julius Chisholm, who was essentially a trauma expert. He was quite an interesting fella. And he brought in a lot of information on how to take care of trauma patients. But this particular physician, he was dealing with a Union doctor, Dr. Hamilton, Hastings Hamilton. He was a professor, became a Union physician, and he was evaluating all these cases coming through. And he saw that within the first 6 hours, patients remained in a state of shock. They didn't have ACLS, they didn't have IV fluids, they didn't have blood transfusions. So it was like trying to settle the vital signs, getting the blood pressure under control, control the bleeding, and then you can go ahead and do the amputations within the next 24 hours. So that was now another hallmark that we like to do too, is you bring a trauma patient into the ER, we stabilize them first before anything else is done. Drugs that we used in the Revolutionary War, they still were using the same arsenic and mercury in the Civil War at the beginning. But eventually that started to phase out. And that also ended this heroic medicine that you hear about, where they were giving, you get a little bit of medicine, it makes you feel good, you give a whole lot more, bigger doses, and more frequently until you're in complications or you die. So that's called heroic medicine, and that kind of stopped during the Civil War as well. Good things came out of it. And this particular case history has to do with plastic surgery and the very beginning of plastic surgery with the flaps. These gentlemen were really in such trouble. So many lost their lower jaws. They were disfigured from the wounds and from infection. The South itself, however, the Confederacy was really good. They perfected the wiring of the mandibular jawbone. That's something that came out directly from the South. Artificial limbs. You know, we've always had artificial limbs, right? You know, the peg leg and the whole business like that. Well, it wasn't until amputations, because of, and I had the bullets going around here too, those mini balls caused a lot of the shaft of the bone to splinter. There was nothing else they could do but to amputate. So during the Revolutionary War, however, it was just the musket ball. Here, we'll have those passed around again. And the musket ball didn't always shatter, but it would have a higher risk of infection. And during the Revolutionary War, they would just go ahead and say, okay, let's just amputate. Civil War, it was like a necessity to amputate because they were useless. So because of all the amputations, the artificial limb business really grew. Really, really, really grew. And even the same names back then are used today. The same companies still exist today. Now, I do want to read you something. The advancement of rehabilitation medicine found its birth here. And this is in quotes. Rehabilitation consisted of finding a suitable prosthesis, assisting the patient with his acceptance and successful use of the artificial limb, and adjusting to a new lifestyle, unquote. Doesn't that sound like rehab medicine today? Exactly. This is where it started. There were 60,000 surgeries done during the Civil War, and 95% of them used anesthesia. They used either chloroform or ether. Ether was used in the general hospitals. Chloroform was used out on the field because ether is flammable around candles. They worked at night too. The only time they didn't use anesthesia is if there was a delay in those supplies arriving, or if there was some kind of facial injury that would compromise the airway. They even used it cleaning the wounds because they used sometimes bromide in the wounds or nitric acid, and it was extremely painful. So they would just put them out. But here's the thing. So many memoirs of soldiers are saying, oh, it was terrible. They had to hold him down and his legs and arms were flying around. It was just awful. It was a nightmare. The truth of the matter is chloroform does that. It stimulates the muscles. So another brilliant fella, back to good old Dr. Chisholm, decided to give hypodermic morphine before the anesthesia was given. Went in under, calm, none of this fighting, and he woke up calm. So they started giving morphine before and after surgery. What does that sound like today, guys? It's done today too. And this is a picture of my book. I just want to see if you recognize this house. Look familiar? Barrington Hall. And this gentleman was dressed up as a colonial person, a colonial soldier, and he works at Fulton County Teaching Museum, a buddy of mine. We also did a little bit of work in this book dealing with African slave medicine and some of the herbs that we use today. So it has something for everybody. And I would appreciate if any of you would like to buy it. That'd be great. Proceeds will go to the Roswell Historic Society and keep our archives working. So thank you for your kind attention.